As of October 1st, the U.S. federal government has officially entered a partial shutdown after Congress failed to reach an agreement on a new funding bill. Based on public statements, the core of the impasse lies in a fundamental disagreement between the two parties on key policy priorities. On the Democratic side, leaders including Senate Leader Chuck Schumer and House Leader Hakeem Jeffries state that the direct cause of the shutdown is the Republican refusal to negotiate an extension of subsidies for the Affordable Care Act, ACA. Citing reports from organizations like the Kaiser Family Foundation, they warn that without action, millions of Americans will face a disastrous and significant increase in their health insurance premiums. On the other hand, the White House places the responsibility on the Democrats. A spokesperson for the administration has indicated that the root of the deadlock is the Democratic insistence on using taxpayer funds for health care benefits for undocumented immigrants, a measure the administration explicitly opposes. Currently, the shutdown has impacted some federal services, and the White House has warned of potential layoffs for thousands of federal employees if it continues. In Congress, both sides are calling on the other to concede, but the dispute over healthcare and immigration-related funding remains the primary obstacle to reopening the government.
We're on day 2, unfortunately, of a government shutdown. The president, the vice president, the entire team here will continue to work and talk to members on the Hill to try and come to a resolution, to try to encourage Democrats to muster up the courage to do the right thing. And we believe there will be a vote taking place tomorrow, and we hope that vote will lead to the government reopening. That's what the president wants to see, and that's what we're working on today. Look, it's likely going to be in the thousands. It's a very good question, and that's something that the Office of Management and Budget and the entire team at the White House here, again, is unfortunately having to work on today. These discussions and these conversations, these meetings would not be happening if the Democrats had voted to keep the government open. Do you think that illegal aliens should receive Medicaid benefits? Medicaid benefits that go to the most vulnerable people in our country. That Medicaid benefits that were designed to help low-income families and Americans in our country. And what the Biden administration did, Gabe, is they allowed tens of millions of illegal aliens from all over the world to come into our country, yes, and they paroled them into the system. And you cover immigration, and you know well, it was a complete abuse of our immigration system. And they slapped a Band-Aid on these illegals. They called it temporary protective status. And then they allowed those illegals from all over the world to get free benefits. And you know who would like free benefits? Hardworking Americans who work their butts off every day, who are living paycheck to paycheck because of the Biden-induced inflation crisis. And there were higher wait times at hospitals under the Biden administration. We saw these illegals committing crimes all over our country, and they're getting things for free. That is fundamentally unfair, and this administration is not going to support it. Democrats have voted for the clean continuing resolution that Republicans introduced 13 times in the past. 13 times. They voted for it as recently as March. And now all of a sudden they are shutting the government down, and they are holding our country hostage over a partisan political matter that the vast majority of the country disagrees with. And they know it's so unpopular that they're now running away from it. I saw some senators on television this morning saying, we don't want to give health care benefits to illegal aliens. Yes, you do. Roll the tape. You can see time and time again, Democrats have supported that. They've voted for it, and they did it under Joe Biden. And we stopped it. The president stopped it with the passage of the One Big Beautiful Bill. And now they want to undo the president's very popular policy to ensure that taxpayer-funded health care benefits only go to tax-paying, law-abiding American citizens.
And today's October 1st, the first full day of Donald Trump's government shutdown. Donald Trump and Republicans have barreled us into a shutdown because they refuse to protect Americans' health care. It's clear that the way out of this shutdown is to sit down and negotiate with Democrats to address the looming health care crisis that faces tens of millions of American families. Democrats want to avert this crisis, but Republicans tried to bully us, and it's clear they can't. They don't have the votes. The way out of this is for Republicans to finally roll up their sleeves and get to work. Republicans need to get serious and start actually addressing the looming crisis and reopen the government. Now, why has all of this happened? Why are we here on October 1st? Because Republicans have tried to stick us with a partisan CR that fails to protect Americans' health care and does nothing to fix the healthcare mess that they created. It has now failed twice to get enough votes in this chamber. So Republicans need to negotiate with us. And Speaker Johnson's got to get his people here. If anyone wanted evidence as to who wanted this shutdown, just look at the fact that Johnson does not even have the House in session. When Democrats had the White House, the Senate, and the House, when Democrats had the majority in this chamber, when I was majority leader, we never had one shutdown in 4 years, not one. You know why? Because we worked with our Republican colleagues to find a way to keep the government funded. We did this 13 times, as Leader Thune likes to remind everyone. That's a lot of bipartisan negotiation, but not this time, not so today. Republicans need to negotiate. Today is October 1st, and that means something else is happening today. Americans throughout the country are opening their mailboxes and finding letters in there telling them that their health insurance is about to go way, way, way up. The other day, we thought it was about $400 a month that the average American family would pay more in insurance premiums. But it turns out it's even worse than that. The Kaiser report, the nonpartisan, well-respected Kaiser report from yesterday says it's on average of $1,000 a month, and God forbid even much more for so many Americans. Healthcare premiums, because of what the Republicans have done, is going up 114% a year on average. The average premium is going to more than double. What's the average American family supposed to do with that? What happens on Friday night when the family sits around the kitchen table and says, how are we going to pay the bills, when they see that their insurance could be $1,000 more a month? Health insurance, vital to the parents, the children of the family. What are they going to do? The average American can't afford $1,000 a month or even $400 a month without cutting back on their health care or cutting back on something else that's vital. You know, Mr. President, Americans are saying the number one issue is cost. They now rate Donald Trump worse on costs than they rated Joe Biden, and he didn't have very good ratings. It's the tariffs. It's the change in electricity costs because of what they've done with the cheapest and cleanest source of energy and putting electrons on the grid, which is solar. They got rid of it in their fanatical hatred of clean energy, and now they're putting money into coal. It's incredible. Because of costs of groceries, of meat. But the number one increase in cost now, on October 1st, is healthcare costs. And the average American is going to say, what the heck happened here? And we Democrats are going to be there every day, every hour. Senate, House, groups that care about healthcare, hospital groups, healthcare groups, research groups, and letting them know this didn't have to happen. It happened because our Republican colleagues wanted to give tax breaks to billionaires and cut their health care.
Thanks very much for joining me. As most of you know, the government has been shut down. Why? How do we reopen it? So let me say a few words on that. Under long-established Senate rules, it takes 60 votes to pass a continuing resolution to fund the government. The Republicans have 53 members in their caucus. Democrats have 47. Bottom line, as has been the case for decades, the two parties must negotiate to reach an agreement. But in an unprecedented manner, Republicans have refused to do that. They have refused to sit down and work out a bipartisan solution. In their view, it is their way or the highway, take it or leave it. And that's why the government has shut down. But this shutdown is far more important than just Senate process. at a time when the American healthcare system is deeply broken. We are the only major country on earth not to guarantee healthcare to all people. We pay the highest costs. Trump's big, beautiful bill will make that situation in healthcare even worse. As a result of that legislation, 15 million Americans will be thrown off of Medicaid and the Affordable Care Act. Studies from Yale University and the University of Pennsylvania suggest that when you throw 15 million low-income and working-class people off of the health care they have, some 50,000 Americans will die unnecessarily every single year. Let me repeat that. I know it sounds amazing, but it is true, and it's understandable. If you're throwing 15 million low-income and working-class people, many of them with serious health problems, off their health care, they can't get to a doctor when they need to. It is not shocking to understand, or surprising to understand, that 50,000 of them will die unnecessarily every single year. That's what we're looking at. And then, on top of all that, the Republican bill also cuts tax credits for the Affordable Care Act. A study just came out yesterday from the Kaiser Family Foundation, a nonprofit healthcare organization, and its findings are pretty clear. Within the next several months, healthcare premiums for 20 million Americans on the Affordable Care Act will double. Got that? Double. So you think that right now you're paying an outrageous amount for health care, and you are. And right now you can't afford health care, and many of you can't. Under the Republican proposal, your premiums will, on average, double. This is insane. It is unacceptable. In other words, instead of lowering health care costs, instead of adding more people to health care, cutting back on the number of people who are uninsured or underinsured, what Trump's legislation does is make a terrible situation much worse. So don't get confused. I know there's a lot of stuff in the media, and a lot of people in both political parties are arguing with each other and blaming each other. But to me, what is going on is really not complicated. And that is, if we do what the Republicans want us to do and pass a clean CR with no input at all from the opposition, if we just do that, 15 million Americans will lose their health insurance and tens of thousands will die unnecessarily every single year. If we pass the Republican legislation, your premiums will likely double in the very, very near future. Needless to say, I do not intend to support the Republican proposal. Thanks very much.
It's day 3 of the Trump Republican government shutdown and day 257 of the chaos that Donald Trump has been inflicting on the American people since the very beginning of his presidency. We're in the midst of a government shutdown that has been caused by Donald Trump and Republicans to inflict further pain on the American people. The government is shut down right now because Donald Trump and Republicans refuse to provide health care to working class Americans. Throughout this week, Donald Trump has been missing in action. He remains in the Presidential Witness Protection Program. House Republicans are on vacation all across the country and the world, and Senate Republicans continue to vote on the same partisan Republican spending bill that's dead on arrival because it guts the health care of the American people. Donald Trump and the Republicans are not behaving responsibly. They're not behaving in a serious manner. They don't want to reopen the government, and they certainly do not want to address the health care crisis that Republicans have created throughout this year, including as it relates to their one big ugly bill that hurts everyday Americans in order to reward their billionaire donors. Democrats made clear, including at the White House meeting on Monday, that healthcare premiums, copays, and deductibles were about to skyrocket for tens of millions of Americans all across the country in an environment where the cost of living in this country is already too high. Donald Trump has already made life more expensive because of his tariffs and failed Republican policies. But that cost of living crisis is about to get worse, particularly as it relates to health care costs. Here are just 3 examples as it relates to the types of skyrocketing health care costs that everyday Americans are about to confront. In the Commonwealth of Virginia, by way of example, just one plan. Currently, this health care plan costs an everyday American, a working class American, $595.94 a month. But because Republicans refuse to extend the Affordable Care Act tax credit, that same plan is going to go up to $1,890 per month. How is that possible for working families to afford? That's in Virginia. In Idaho, Silver Plan currently available for $611 per month. But it's now public information that because of the Republican refusal to extend the Affordable Care Act tax credits, that same plan, currently $611 per month, will go up to $2,083 a month in an environment where America is already too expensive, where the cost of living is already too high, where the Trump tariffs are already imposing thousands of dollars per year of additional costs. And now, healthcare costs is about to skyrocket out of control. One final example. In Georgia, the heart of Dixie, in the Deep South, current Silver HMO plan from Kaiser Permanente, currently it costs $699 per month. But because of the Republican refusal to extend the Affordable Care Act tax credits, that same plan, currently $699 per month, is about to skyrocket to $2,763 a month. This is going to cause medical bankruptcy for some, and millions of others will be unable to afford the health care that they need for themselves, their children, and their families. This is why we need to deal with the Republican healthcare crisis right now, because the crisis is having real impact on working class Americans right now.